From across Maryland, Virginia, and the District, this is Washington's 24-hour local news leader. News Channel 8's Live This Morning starts right now.
This month marks Lung Cancer Awareness Month, and the CDC reports more men and women die from lung cancer than any other kind of cancer. And joining us now live in the studio with more on the risks, the treatment, and the research on lung cancer is Dr. Gupta. She's a radiation oncologist. Dr. Gupta, thank you so much for joining us.
Thank you.
We heard in that story there about good screens, mammography for breast cancer, PSAs for prostate cancer, good screens for colon and rectal cancer. The problem with lung cancer is we don't have one of those relatively easy tests that we can find the disease early when it is most treatable. Would that make your job a lot easier if we could figure out that magic bullet?
Oh, most definitely. We know that early stage lung cancer is actually quite curable and treatable with surgery and, in certain situations, radiation and chemotherapy, but has a far higher survival rate than more advanced stages. And you're absolutely right. We don't have a good screening tool for lung cancer as of yet. There's been several studies looking at using spiral CT scanning to screen patients who are at high risk for disease, but unfortunately they haven't been shown to actually be of significant utility as a screening tool.
Yeah, and they tend to be expensive and sometimes difficult to come by. There are some very definite advances to talk about, though, in the treatment of lung cancer. We're much better at managing the disease now, and frankly, cure rates are higher than they've ever been, still very low, but we're making progress.
That's correct, because significant advances in the treatment of lung cancer have been made, most recently with biological therapies, as well as advances in radiation treatments. You know, having treated many lung cancer patients myself over these years in practice, it's the advances in technology have dramatically impacted outcomes. You know, unfortunately, contrary to what it may seem like, lung cancer doesn't get quite the same amount of press as, say, the breast and prostate cancer does, even though it is the leading cause of cancer death. So stories such as, news reports such as what you're doing are actually quite useful to bring attention to this.
It's always been sort of difficult to square those two things. Breast cancer gets a tremendous amount of publicity, lots of organized events to raise money for it. Not that there shouldn't be, but the real cancer killer is the one that we sometimes don't think about, and that's lung cancer.
Right. I think also partly it's because lung cancer carries some degree of stigma. There's a lot of thought, even from patients themselves who suffer from lung cancer, that they've done this to themselves, and it's a barrier to seeking research funding and outcries that you don't see for prostate and breast cancer because of that.